the weekly team brief. We've not got Dave Selwyn this week, so you have me. I am Rob Simcox, Director of People at the Trust. Dave's having some well-earned R&R, a week in Norfolk, I believe. So lovely to see so many of you. I always have to remind myself this is on catch-up also, so I try and do it in a pretense that anyone listening later at a later date can still get a flavour of the messages that we're trying to get across. So we have some guest speakers with us today that are here to talk around all things trust safety alert. So personally, I'm quite keen to understand what a safety alert is and how important they are in relation to disseminating key snippets of information. We have Gina, who's going to give us an update on all things IG. Mailboxes is one of the things she's asked me to prompt about, particularly around the size of mailboxes. I know from my own experience, sometimes I have more emails than I'd like in my inbox. And then we finally have Amy, who's going to be talking all things people well-being. I've also asked Amy just to cover off a little bit around this year's flu campaign that will be starting in the forthcoming months. So before I pass on to our speakers, I wanted to take the opportunity just to firstly congratulate. We had an unprecedented level of interest for our Staff Excellence Awards this year. Over 500 nominations, and for those that were nominated, you will start to receive notification of the nomination and a little snippet of why you were nominated. In my eyes, everyone's a winner, but I do recognise through a process, and I think it was led to believe quite a competitive process of shortlisting. On Thursday of last week, our shortlisters were notified, and I do hope people have started to receive the invitations, VIP invitations. I'm told golden envelopes I think are included as well. That is starting to work its way through to you. So the Staff Excellence Awards happens on the 12th of September. It's a Thursday evening at the John Fretwell Centre, and I'm sure our comms team will be reporting on the night. Probably a live Twitter feed, or is it X nowadays? That's happened in previous years for those that won't get the chance to attend in person. But as I said, delighted to announce the shortlisters, and I'm sure I could ask Andros just to drop in the chat the link for people just to access who have been shortlisted. So thank you. Further to that, I wanted to touch on a little bit around our Armed Forces network. This is something that's new to the organisation. We're always encouraging communities of practice of colleagues to come together under a network banner, and following some of the positive feedback we had from the Armed Forces Covenant that we were awarded a few months ago. Some of you may recall the attendance of Professor John Tan on site. We've had a fair bit of interest around taking this network of colleagues forward. And what I wanted to do a bit of a shout out for today is the next meeting is planned to take place on the 2nd of September. We'll be in the lecture theatre between 1 and 2. If you've not been before, we are encouraging newbies, and we have a vascular surgeon from Sunderland who's the head of Army Medical Reserve. So Brigadier Ben, I won't attempt to pronounce his surname, so I'll probably get it wrong, but we have a guest speaker that I'm sure colleagues will find of interest. If you're not able to make in person, we will be able to watch the be able to watch the event live on Teams, and that will be circulated nearer the event. And then the final one, people may have had emails from NHS pensions in the last 2 to 3 weeks. These are legitimate emails, so just wanted to firstly say that if you've not received it, please do look out for it. And this gives you the opportunity, if you're an active member of the NHS pension scheme, and that's what's key here, further information around your NHS pension scheme. It's a live portal around your pension, lots of informative information, and it was really just a plug that the NHS pension scheme have introduced an app that colleagues can access. And if colleagues are familiar with the ESR platform, where you basically get to see your online pay slips, it's a very similar platform. And we will drop into the chat just a link to where you can get a bit more information attributed to all things NHS pension. So I'll pause there. They were the main messages from me. Thanks, Andros, for just dropping all of those links into the chat. I've not seen any questions from the colleagues we've got with us today. So as you can see, I'm padding a bit here. So what I will do is introduce our first speaker. So welcome, Leanne. I think this is your first time on Team Brief. So for those that are listening, be kind to Leanne. We've all got to do this. We all have a first. And what is key today, you want to talk to us around all things safety, alert notices. Now, for someone that's not clinical, I'm particularly intrigued to understand a little bit more about them. And I guess today is one of many platforms. You're just on a bit of a roadshow promoting some of that wider governance message. So I'll pass the baton over to you and welcome.
Thank you. Thanks, Rob. First time, so be gentle. And Rob's right, we are circulating this information elsewhere, so you may see it repeated in other forums, but we will also have some information on screensavers, intranet, bulletins, things like that. So if you've missed anything today, you can pick it up and go and find some more information on those forums as well. I'm here today to talk about safety alerts and the process around this. And so the reason that we decided to look at this is that we identified when we were reviewing some incidents and scoping those trust level that we didn't really have a process in place across Sherwood Forest hospitals for disseminating urgent information across the organisation, in particular to targeted staff groups. So we do have the iCares, we have the communication bulletins and things, but they can be quite timely to get information out. So what we wanted to have in place is a process that we could, when we've identified something that could impact on patient safety, that we could get those clear messages out to those targeted groups as soon as possible. So we are aware that some of our neighbouring trusts organisations have similar processes in place. So we kind of come away and had a look at what would work best over at Sherwood Forest. And as a result, we've developed a safety alert process. So there is a template available for where the information can be populated. There we go. And very straightforward. What's happened? What should have happened? What can we what can we learn from that? And what are the actions that we need to take place? These can be tweaked as we need to. So depending on what the patient safety alert is, we can have those to kind of fit that information that we need to disseminate. So on the process, it's quite straightforward. The need for the alert will be identified in the relevant forums, and as you can see, those tend to come from, as I say, when we are scoping incidents that have happened across the trust. So normally our patient safety incident review group, which is also known as PSURG, there might be those discussions in our patient safety group, patient safety committee, the maternity governance committees and safeguarding committees, etc. So once that need is identified, the relevant process will start around this, and that actually once we've identified we need to have that urgent comms, this is what we will put in place. So there's a clear time frame for completion, and we've kind of accounted for weekends, etc. But we do, the emphasis on this is it's quite urgent and immediate information that needs to be circulated. It does include executive approval, so we have that in place. And then the information is transferred to our communications team, who will help us with that dissemination across the trust, and also they will help support to store this information in a centralised library so that we can use that to access, for future. We can look at it for audit purposes if we need to go back and have a look at what we've implemented previously. This also allows us to, from a governance support unit, to triangulate the data that we are circulating and what we're identifying as urgent action with the national patient safety alert. So this does differ to those, but what we are going to do is align and have a look at that and identify if there are any themes and trends, and we will escalate that through the PSERF oversight group, which again kind of looks at how we manage our and have oversight of our incidents across the organisation. So the change is effective from now. The process and the documentation has been approved at our patient safety committee. So we are, you might see these coming out. I don't think, hopefully touch wood, they won't be too frequent, but you might see these start circulating around as well. I suppose one question that we will probably get asked is around how does this fit in with iCares? So iCares is a quite well embedded process across the trust already, and to be honest, that's got a purpose, and that kind of still needs to remain. The only difference that we've done with iCares is ensuring that there is divisional sign off for that. So the divisional leadership team will sign off the iCares for dissemination. I think before the process has been a little bit clunky, and it's kind of it's different people that have kind of been signing that off. So that just streamlines that a little bit more and keeps it in alignment with our governance processes that we've got. So as I say, we'll be disseminating this in other forums. We'll be coming out and talking on the Matrons Days, the Senior Sister Days, etc., the AAPs. We're trying to get this message across for everybody, and any feedback at all, if it's how is it working, if it's not working, please let us know, because as everything, it's a new process, we're keen to receive that feedback because it has to work for us all as well. I think for me the key bit for this is that it's getting to those targeted groups, and not you'll know to kind of once you receive this or see this highlighted within your emails or across the relevant forums that you've got, this is information that you would need to be focusing on and reading, really. I think that's a whistle stop tour of that. I don't know if there's any questions.
So I've not seen any questions in the chat, Leanne. I've got one, perhaps just to get the conversation started. Like most things, we're busy people, and sometimes we have periods of annual leave. Will there be perhaps a central repository where some of these are kept? So, if I've been off for a fortnight, for instance, there's an accessible place where I could just get notified of these.
Absolutely. So the communications team are helping us keep a library, a centralised library that's accessible on the intranet for these, so they can be logged and people can kind of go back in and have a look at those as well. The disseminated across the relevant groups, so we will be asking ward, team leaders, ward leaders, matrons, etc., to disseminate that across their forum. So it might be that they include it in a newsletter. There's different ways that message should be reaching out, and it's kind of what works well within those areas and those departments, really. We will be taking them through our governance meetings, so again that'll be disseminated from divisional level down as well. So there will be access available. We recognise, if it just went out on an email, that wouldn't be enough. We get inundated, don't we, with emails, and you go on your leave and you don't always get to the bottom of them. So we want them to be accessible, definitely. And if there are forums that you feel they need to be shared at, and if we've not reached that, then again that feedback would be really helpful for us to understand that.
Thank you. So I think we've had a question. So couple of questions here. So perhaps to start off with, one of the questions say, thank you, Julie. It's a general question, and I suspect the answer to this will be yes, won't it? Around how the template could be used within any department for learning. My initial thoughts, Leanne, that seems a very sensible thing to do,
Yeah.
but
Yeah, I absolutely get your point, and I think they're a good format. I think what we probably wouldn't want to get it mixed up with is just being used in place of that immediate learning, because we want this to be actually, we need to take notice of this, and if we use it for the general communication that isn't that immediate response, learning, dissemination, we might fall back into the eye care process where kind of everything gets muddled in there. So I would absolutely say, use the template, perhaps tweak it a little bit to make it work for you. There's lots of, it's good, it's short, it's snappy, it's visible. It's eye-catching, isn't it? Really. But I would just be mindful of, this is for safety, that immediate safety alert information being disseminated.
thank you. And a great prompt from Gina around how we might want to embrace technology. And I think that's a good reminder to us all about how not always relying on one method to communicate key messages, how we might embrace some of the MS Teams channel, and probably something we might want to explore more generically in the dissemination of information. But a good reminder, Gina, so thank you. So, not seeing any other questions. So thank you, Leanne.
Thank you.
I think the take home from me is we've took the opportunity to do some of our own learning, and we've decided just to strengthen practice, particularly in around the dissemination of key information. It sounds like this is evidence-based, Leanne. So it's not based on it's a good idea. It's got a bit of evidence behind it. And more importantly, there'll be a central repository for individuals where they can capture all learning incidents. So thank you.
Thank you.
And probably a bit of a prompt for anyone listening. I think I heard you're happy to perhaps go to forums you'd not mentioned on your update.
Yeah. So if there's anywhere that we don't reach, absolutely more than happy to come out and have those conversations. So please let us know.
And what would be the best way, perhaps, of getting hold of you if somebody was interested?
So you can email me directly, or we've got the governance support unit generic email that you can contact us, and you can ask me that for now, but I'll put it in the chat.
Lovely. Thank you. Thanks for your update. I don't think you did a bad job for your first time of Team Brief, so well done. As I said earlier, we've all got to start somewhere. I think we're over to you now, Gina. I don't know if you've got any slides you're presenting, or is it just a general update around all things IG?
I've just got a couple.
Lovely.
More of a prompt for me to remember. But I thought it would be useful to put a photo of the team for the information governance team that we have at the Trust. There is a new lady that started in our department, so she's not on the team photo, yes, but there's myself, there's Jackie Widdowson, who's our data protection officer, and then we've got Jodie, who does a lot of data protection work within the team, and then there's Lindsay and Sue that provide copies of records to patients and solicitors. So I thought it would be a good start to introduce the team. So I did have a small agenda to go through. I first wanted to start with subject access requests. So these are everyone's right to have access to copies of their information, whether that's you as a member of staff. You can approach the Trust to view your staff record, or you can indeed request a physical copy of that record, and the same applies to patients. So to give you an idea of number of requests that we do get, figures for May, we had 332 requests for copies of patient records, whether that's a solicitor for if they've been involved in an accident, or if they just want to have access to their records. And then in June we had 295, so they did reduce a little. Staff-wise, we had 5 requests in both May and June, requesting copies of various bits of information, whether it's their staff records or whether it's indeed copies of mailboxes. So my next area to talk about is that patients and staff do request copies of emails. So within the IG team, we've got a process where we're very clear when someone requests information whose emails they're wanting. We come up with search criteria that's agreed between us and whoever's requesting. That is the search criteria that we do use. It's a very strict search criteria, so we're not going through mailboxes. So we do seek authorization from either Rob or Dave as chief exec to get access to these mailboxes. And what it is we get a copy. Say, for example, say the individual wanted emails from the last 3 years, we would receive a copy of the entirety of that mailbox, your Outlook mailbox, and we would then physically go through that Outlook mailbox looking for the search criteria. So one plug from me is that be careful what you do. I've always said it with IG training, be careful what you write in emails, because they can be requested both under freedom of information and both under data protection as well. So we are trying to sort out a process of informing you, but it will be after we've obviously retrieved that information from your mailboxes if you're subject to a request. So that's my first one, really. Rob, do you have anything to add at this stage, or shall I carry on?
Carry on. I was going to wrap up depending on questions.
Okay, lovely, thank you. Yeah, so just on the other side of what we do with subject access requests, so again, you're right to request the copy. I've not told you where to get it from, have I? So if you contact the information governance inbox, that's how you can request a copy of your staff record. But obviously, if you're a patient, we've got the SARS team that manage that. So that's SAR@nhs.net. Okay, so with data, the opposite of data protection, I see it as freedom of information. So we do also receive a lot of requests within the trust for people wanting information from us. 2019, we received 493. In 2024, we're predicting that to be 954. So that's quite a big jump, over 50%. You know, in the last 5 years, it's increased. People ask us various amounts of information. We have 20 working days to respond, to either tell them that we hold it or that we don't. We won't release your personal data. So if somebody wants information about a member of staff, say they want a copy of a contract, or, you know, if they want a copy of your, I don't know, your job description, for example. A job description will be disclosed because that's, you know, published when the job's advertised, but anything that's personal about you or, you know, your pay or anything like that will not be released because that's personal data. But as I say, we're predicting about 954 of these freedom of information requests. If you want to see what we get request-wise, we do publish them on our website, and we do publish the responses that we send out as well. So next one to talk about is a system that we've got, is called Fair Warning. So this is something that's going in the trust imminently, and it will be reviewing. It's a system that will be reviewing inappropriate access or flagging to us in the information governance team if there's something that we need to be looking at. So for example, you should not be looking at your own records. There is a process, clear process for you to gain access to your personal data should you wish to have it. So again, another plug, you cannot access your own records. Okay. Also, you should only be accessing the records of individuals where you have a legitimate need. So for example, you're involved in their clinical care, then you can, you know, obviously as part of your role, look at those records. So Fair Warning, what it will do, it will identify if you're looking at people who live in the same house as you, people with the same name as you on the same street, you know, if you're snooping, or indeed looking at records for an individual who's not been at the trust for quite a number of years. So that we will have a process in place for reviewing these audits that come to us, these flags, to make sure, you know, that staff are doing what they should be doing, really. So that's imminent. Another plug there on the back of that is to make sure that we're looking after our movers and leavers with access to systems. So one thing that we do see is people change roles within the trust, and they sometimes retain the access to systems that in their new job they don't need. So a plug to line managers just to make sure they are actually completing the, like the leavers form checklist within the trust, so we can like make sure that access is taken away. Okay. And on the back of inappropriate access, the Information Commissioner does, who's the regulator, a bit like the CQ is the regulator for the, for the trust, the Information Commissioner is the regulator for data protection. So they do take inappropriate access to records very seriously. And there was a recent case where an individual was accessing records inappropriately for personal gain. Whatever that personal gain was. It could be just snooping from our perspective in the trust. But anyway, the judge did impose a fine. It is a criminal conviction, and the fine totaled £12,000. And the judge did actually say that he had to pay that within 1 year. And if he didn't, it held a custodial sentence that he would be sent to prison for 9 months for not paying. So it is, the regulators do take inappropriate access to records very seriously, and it carries a criminal record. Okay, sorry, I'm all doom and gloom, aren't I? So next thing to talk about is projects and data protection impacts assessment. So if you or your teams are using personal data, you're wanting to buy a new system or do something different with personal data, it's a good idea to get in touch with us in IG, because we need to have a look at it from a privacy perspective, especially if we're using external suppliers. If we're outsourcing some of our services, for example, then we do need to make sure that we're doing our due diligence with those suppliers and they are secure from a cyber perspective in order to look after our data for us. So yes, just a plug there to get in touch with the information governance team for that. Printer incidents. We do seem to have an awful lot of printer incidents at the moment where people are clicking on sending to print and they're printing out in different areas in the trust. So there are quite a lot of printers that don't form part of the what they're called, the Ciros machines, where you present your card to a printer and then prints out what you've sent to the printer. So in an ideal world, those are the devices that we should be using, but we are aware there are around 900 devices that around the trust that direct print. So without the use of a card, and you just send it to a printer. So we're wanting to reduce the number of those and rely more on the MFD, the multifunctional devices that we've got around the trust. So if anyone is aware of information that they're sending to print, it doesn't come out, then please do let us know, because we're trying to track why it is that some of these incidents are happening, and trying to track down to source and try and get to the bottom of why we're having so many problems with printer information going to the wrong place. So if you get in touch with the IG team again. And then my final plug is, if you want to come and talk to us, we've got the next IG drop-in clinic on the 16th of September between 12:30 and 2:30 in the boardroom. So if you've got a concern, confidentiality, you're not sure how to approach something from an IG perspective, then please do drop in. We will have tea and biscuits. So that's it really that I wanted to talk about today, Rob. Thank you.
Thanks, Gina. I'm sure tea and biscuits would encourage anyone to come along and have a conversation with you and the team. So a lot of information in what you've just shared. I would anticipate, Gina, you're just doing a bit of a recap of some of the key messages that are in our IG training, and going into a little bit more depth and detail of the rationale of why. I'll certainly reinforce that subject access request. We have started to see a few more of these in the last few months across the organisation. Unfortunately, that on occasion has asked for individuals' mailboxes to be searched. I'll always encourage everyone, always be careful about what you disclose in an email, because it is retrievable. It's a form of record, isn't it, Gina?
It is, yes.
I know sometimes it may be considered as perhaps an informal communication platform, but it is disclosable. So it's always worth thinking about the audience that you're communicating with. So I've not seen anything in the chat. I'll probably put that down to as quite a comprehensive overview, Gina. Lots of detail. I'll probably go back to just reinforcing the point around it's good to talk, and it might be just useful for you to just circulate in the chat option, Gina, how anyone can get hold of either yourself or the team if they've got any queries relating to what can sometimes be quite a complex piece of legislation that you and the team do a sterling job of making look simple. So thank you.
Thank you.
So I'll move us on to our last speaker today. So welcome, Amy. Nice to see you on this platform again. And you're going to talk to us a little bit about a wellbeing survey that's taken place. But building on some of the conversations we had in the pre-meet, I did think it was a good opportunity just to reinforce as we move into winter. I know it is sunny outside, but we are starting to do some annual preparations for winter. Might be a good platform just to reinforce the plethora of support that is available to our people.
Brilliant. Thanks, Rob. Thank you for having me on Team Brief. It feels like it's been a while. Hello to those obviously watching on Catch Up. So my name's Amy Goldstone. I'm the People Wellbeing Lead here at Sherwood Forest, as Rob says. We have a generic inbox for wellbeing that myself, my colleague Corinne and our clinical psychologist, Dr. Sarah Toft, monitors. So if you've got any questions about the things I mentioned today, please don't be afraid to reach out so we can direct you to the resources that we're talking about. If we go to the next slide, there will be a QR code. So as Rob mentioned, really excited to talk to you about our wellbeing survey. So we've put this in because there's a few questions that are asked in, say, the staff survey, for example, about wellbeing, but it doesn't always give us enough detail about what we're doing well at in wellbeing, what we need to do a bit more of, what we might need to do differently, and particularly what we're interested in as well is obviously, of course, what you think to some of the wellbeing services and wellbeing offer, but how best to communicate with you. And Rob mentioned earlier when Leanne was presenting about how we communicate. There's quite a lot of channels to communicate with you, but sometimes we still don't always get the messages to the right people at the right time. So we're hoping what you tell us in this survey will be able to help inform what we do. So it takes potentially up to around 10 minutes to fill in this survey, depending how much you've got to tell us. You could probably do it quicker if you fly through, but there's a few different sections. Obviously I've mentioned about the way we communicate, for example, and what you think. There's another question in there about flu. So Rob very kindly reminded me that winter is around the corner. It's not long away, which is quite terrifying. There is a colleague in our office, so I won't mention any names, who's got an app counting down to Christmas already that was singing to us the other day. So it is coming, but I am also really conscious that winter hasn't stopped in terms of pressures at times as well. So I suppose it's this time for us to really get an understanding of what you need in that time, but also I can obviously remind people of where you can go for a little bit of support as well to getting ready for those pressures. The big one, of course, as well is flu jabs will be coming out before you know it as well. So expecting delivery around the end of September for these, so not quite yet. Some colleagues will be peer vaccinators, so you'll be able to get your vaccine there, you'll be able to get it through occupational health. There'll be the drop-ins. We've got, if you have your flu jab, you'll have a free drink, and there's the monthly prize draw as well, supported by Unison. So within the survey, we ask a bit about flu, whether you get your flu jab and whether and what stops you if you don't. Something I've not mentioned actually is obviously this is all anonymous, so we don't know who said what. So we'd really appreciate people being really honest in that to help us learn a little bit more about how we can make sure the things like the flu jab or other wellbeing offers are really accessible to everybody. I know from a flu perspective, I love the fact that we get a free flu vaccine. You have to pay for this if you don't work in the NHS or you haven't got a long-term health condition, but actually having this protects you, stops you getting poorly and obviously unwell. But I've found before when I've not had a flu vaccine and I've come unwell, I've had flu once that I know of, and it ruined all my Christmas plans, it ruined all the holiday plans, meant that I couldn't connect with family. But equally, we know that it really protects us, but it protects the people around us as well. So I've got a new little baby baby in our family, I've become an auntie again, the thought that I could pass on flu to them if I've not protected myself is something that's really important to me. So having a flu vaccine can help protect you, but it can help stop you passing it to other people as well. So do look out for that. Like I say, towards the end of September when the vaccines are ready, but I hope you take up that opportunity to have your flu vaccine. And like I say, within the survey, if you could tell us a little bit more about how we can make sure that that's really accessible for you as well, that will help us in this sort of run up to, dare I say it, winter as well. So that's perhaps enough for me on the survey. The links there. Oh, just one thing to mention: if you really, if you are a team that really doesn't use digital platforms but would appreciate paper copies, there's a link where you can on our website that you can print a PDF version, or if you drop us an email, we'll get some to you if you would like to do paper versions to make sure as many of your colleagues do fill that in as well. That's the survey. So I want to take the opportunity as well, again, in this run up to sort of winter time and being prepared. We have some big national events around mental health and suicide prevention. So I wanted to give you fair warning. We would love everyone to wear something yellow 10th of September, which is World Suicide Prevention Day, just to mark that day, and also acknowledge that that's an opportunity to start a conversation with somebody. If you wear yellow, I certainly don't wear yellow very often, so if I was wearing something yellow, it gives me an opportunity to talk about where people can reach out support if they're struggling, and all being well, we'll have our buildings lit up yellow on that day as well. And then the next slide should tell you about World Mental Health Day. Thank you, Andros, in the background there, clicking across. So World Mental Health Day is the 10th of October. So on this day, we'd really like everyone to wear something green. It can be green socks, it can be, a hair clip, it can be a bobble. It doesn't have to be a full green outfit, of course. But and again, this is to mark World Mental Health Day. And this year in particular, we're really keen to make sure that we do some events between World Suicide Prevention Day and World Mental Health Day. And we're really lucky that the colleagues across the integrated care system, including our colleagues in Nottinghamshire Healthcare, for example, are helping us run a series of lots of webinars. Basically, you can attend and join in to learn a little bit more about the support for mental health and perhaps what you can do to support others. And if we go to the next slide, it tells you a little bit more about those and where you can find them. So there's a few that I'm waiting to confirm speakers for, but the ones that are listed there are things that are already available for you to book now. So supporting a colleague in distress, dealing with difficult information, so that'd be things like difficult data and having to read reports and things like that. Then there's a session on investigations and coroner's processes and supporting your mental health through those. We're doing our coping under pressure course, and then we've got a couple of react and training sessions as well. We'll be joining our colleagues across the system, so you might see colleagues there from social care, you might see colleagues from Nottingham City Care, Nottingham University Hospitals and Notts Healthcare as well. So we're doing this together to bring these events to you with the expertise that we've got across our system. So quite excited about supporting those. So watch this space for more information. They'll come in the bulletin as well. And I think it's really important that I point out that I've talked about some big topics there: suicide prevention, mental health. If you are in distress yourself, if a colleague is in distress, if a family member, a friend, a neighbour is in distress, or you're worried about them, we have the crisis access line in Nottinghamshire that people can access, and the colleagues on the end of that line can help support you. So even if you, at that point, if you're really worried about someone's safety, you could ring that and potentially share information to make sure that that individual stays safe as well as sort of seek support for yourself through that crisis access line. And then the other option is texting the word shout as well to 85258, as you can see on the screen there, and you get text support with a volunteer that's trained to support people through mental health crisis or worries and anxiety, depression, sort of thing as well. And that's all in addition, of course, to our Viv Up support that we've got for our counselling offer and our 24/7 phone line as well for colleagues. But I think it's really important that I just mention those with me mentioning those big topics today as well. And then Moving on from mental health and suicide prevention, I can't believe that this time has come round again. We are doing our becoming famous, I suppose, for our World Menopause Day events that we do again across the system, and this is Friday the 18th of October this year. So the registration link has just gone live, so you can register for this event. We encourage people to register. Even if you can't attend all of it, you might be able to attend part of it, but we'll also sort of you'll have access to different bits that we've been able to record and that sort of thing by registering as well. So yeah, 18th of October is yet another day for the diary. So it's all going on, all going on in wellbeing. I hope that's given you a bit of an idea of some of the things that you can access, and obviously preparing for the busy times or the continuing busy times going forward as well. And any help with getting the survey filled in would be greatly appreciated, because there's a few people on this call, but it's you passing that message on to colleagues that will help us get more and more information that we need to support you and your wellbeing. So thank you for listening, and like I say, do drop us a message on the wellbeing inbox if you need us.
Thanks, Amy. A lot of informative information there. I'm sure our comms team will do a sterling job and just drifting out those dates as we get a little bit closer. I jotted some of them down to remember to wear something yellow on the 10th of September, for instance. But that'll trickle out in the weeks to come. And I guess because we've not got any questions in the chat at the moment, one to perhaps just lead off on is, I didn't know if it was a good opportunity just to remind people where can you access all of this information, Amy? Because like most things, you normally perhaps go weeks, may even be months at a time when you're okay at work, but there's that odd occasion where you've had a bad day, perhaps a bad week, and you've not got that information to hand. So I'm always a big believer in just making sure people know where to access information when they need it, because sometimes we're not all ready to ask for help. So I didn't know if it's a good plug just to where's the repository of information for individuals when they feel the need to probably access some of this support that you've described today.
Yeah, great question, Rob. Yeah. When you go onto the intranet, you can access this through our intranet fairly easily. There's a purple tile, health and wellbeing, with that logo that you'll have seen at the beginning of my presentation, little lotus flower. So you can click on there and it takes you to everything that I've talked about today and more besides, in terms of where to reach out. And when you're on that website as well, you can go down left-hand side and find all that information. The other great thing about our wellbeing information is it's available on the external website, so you can access that from home as well. So if you go to your Sherwood Forest Hospital website, as you would, look for healthcare professional section and looking after your wellbeing, you'll find it all there, so you can access it at home if you feel you don't want to access it necessarily from the internet. If anyone struggles as well, they do drop us an email through the wellbeing inbox, and obviously we can guide you. We're working on our website design a little bit as well to hopefully make it a little easier. So that'll be also things that kind of come and change in the coming months, but it'll still be in the same location. And I always do say to people, please do save the phone numbers and save the website to your favourites and save it to your phone book, so you've always got it to give to someone else, but you've always got it for you, because you're right, Rob, you might not need it now, but you might want it in the future, and your brain can't always think when you're in that point of needing help. Can't quite remember what it was that we said and where to find it. So do save it to your favourites, and do save the phone numbers to your phone, whether that's Viv up in the access line, so you've always got those to hand to give to others as well.
Thank you. I think that probably draws to a closure today's team brief, and not seeing any questions, but we have got Gina. Gina, did you want the last word before I sign off?
Oh, I don't know about the last word, Rob. It was just something that came up in the chat about mobile devices. So one thing that I didn't mention is that we should be only using work issue devices for work. So we should not be using personal mobile phones for work purposes. So whether that's, not having a work mobile is something that we should be having rather than relying on a personal, because we do have requests from members of the public for copies of phone conversations, whether that's WhatsApp, whether that's through the iPhone, and if that is a personal device and it's got, you know, trust information on there, then that's something that we can access. So I know contentious, but yeah.
Yeah, it certainly is contentious, and I do wonder, Gina, if we might want to, perhaps just as a side, as we get some messages that go out from Team Brief, if for whatever reason individuals felt they perhaps historically accessed work-related matters on a personal phone, what's the process to get a trust device? Because otherwise I suspect you might be inundated with questions. So I'm sure we can build on some of those key messages to go out on this Thursday's bulletin. So thank you. So that draws to a closure today. I hope people have found it useful, a really varied update from our three guest speakers. So thank you, really informative as well. And again, I'll go back to perhaps those opening remarks I had around Staff Excellence Awards. Absolutely delighted to nominate, to announce some of the shortlisting colleagues. But as I said, all the nominees are winners in my eyes, and congratulations for the outstanding work you've done over the past 12 months. So I'll sign off, I think. I hope people have found it useful, and enjoy the rest of your week.